just a quick recap of what goes on in a department called decontamination. And decontamination is an area in a hospital, central sterile department where use instruments and equipment is received. Okay, that's a room that is considered dirty room, right? Dirty room because everything that has been used on patient comes in that room. And in that room, it is expected from you to put on what we call personal protective equipment. In as much as the room is dirty, if you take that necessary precaution, you have nothing to worry about. And I always say that there's a reason why there are people doing this job for 30 years or 20 years and they are still in their 15 years, 10 years, they're still doing the same thing, right? Because there are measures to keep you safe at all times. And as we go through the course, we emphasize or we lay more emphasis on some of these things that will keep you safe, and many other things that we teach you. We hope that you will follow the instructions. And even when you get there, the policies that are established to protect you will continue to follow those policies and procedures. You put on your personal protective equipment. First of all, before you put on PPE, you wash your hand, right? When you wash your hand, you dry your hands, and then you put on your PPE. From your head to your toe, everything is covered. Before you touch anything in decontamination, you should make sure that you are fully covered, you're fully protected. Now, it doesn't matter how clean a medical device or equipment may look in decontamination, you should never touch a medical device that have been used on a patient with your bare hands. You must always put on PPE. I can't stress on that. PPE is a requirement by Department of OSHA, Occupational Safety, right? OSHA, there's a clause in OSHA regulations that require that anytime anybody is working with body fluid or blood, they must put on PPE. So PPE requirement does not only pertain to central sterile. No, even in the OR, when you work in the OR, when you work during surgeries, if you've ever been in surgery, you will realize that everybody have something on PPE. For that, most of them have sterile PPEs on. Okay, it is the same thing. It is by law that when you're dealing with body fluid and blood, you must wear PPE. So you always have to stick to that. Secondly, before you even get to decontamination, in the department, you've had a huddle, and the huddle will discuss what to look out for. Priorities. Priorities in the department is what to prioritize so that if there's a case that requires certain instrumentation, that is what we focus on when we see those trays. We stop everything and then prioritize those trays. Okay, prioritization. It's a word that must stick in your head. It's very, very important. So whilst you're in decontamination, you scan in the tracking system. A lot of hospitals have different tracking systems. The tracking system is a computerized system that we scan the instruments, we stabilize, we are cleaning, right? And all the job that we do will be scanned under the tracking system, decontamination section. There will be a module on the tracking system. Wherever you are assigned to work in central sterile, there will be a module. So if you are in decontamination, you click on decontamination. If you are in inspection and assembly, you click on inspection and assembly. If you are stabilizing, you click on stabilization. If you are in case card, you click on case card. Everything that you do must be under where you have been assigned to. Okay, there's a lot of, we're going to have a lecture on tracking system in chapter 19. So we have a long way to go, but we're going to talk about all of that. So when you log into the tracking system, you're going to scan all the trays that have been received in decontamination in the tracking system. Okay, once you scan all the trays, it gives real-time information on when those trays were received or when those equipment were received in our department, decontamination. And the reason why this is important is that there are instances where OR say, well, the case, we finished the case around 9 a.m. Why are we getting why is the train off sterile, right? So to avoid all of that, when you receive a case card, you scan it in the tracking system to tell the time the trays were received. That is not the idea, but the bigger picture is that in the future, when something happens, patient is infected, we have to go back to see if we clean the medical device. The tracking system will give us that information we're looking for. That on this date, at this time, this tray was scanned in Decon, it was processed by this person, it came to inspection and assembly, this person scanned it, right? So we have record to show that we did the right thing. That is one of the main reasons why tracking system, scanning trays in the tracking system is important, okay? Now, the other thing is that if we are looking for a tray, OR calls for a tray, and we go to locate, just so you know, based on what tracking system you may have, there's also an icon that enables us to locate trays. So when you search the tray, it will tell you that the tray was scanned in decontamination at 9 a.m. So we will not go crazy looking everywhere else. Meanwhile, the tray is sitting in decontamination. Now, if you fail to scan the tray, that is what we'll be looking with. We'll be looking around like chicken without heads, right? Because somebody failed to scan. We wouldn't be able to know exactly where these items are. Okay, let me move on because we have a lot to talk about today. So when you scan your trays, you're gonna actually, like the sink must have enough soap. You saw how to change the soap in that video. That's the same way you do when we get to the department. When the soap is all the way at the bottom, you want to replace it. If not, when you command soap, when you press on we call it detergent pump, when you press on it to get soap in your sink, it will be suctioning air. Okay, air will be rather coming in the sink instead of soap, because the detergent in the gallon is all the way at the bottom. So the pump is not getting enough soap to place in the sink for you to do your manual cleaning. Also remember, the sink has been measured. So we need certain proportion of soap in our sink based on the water line that is in the sink, okay? So if I have to go through that, again, we did that already, but those who are going to watch the video, I did explain that as well, so you won't be lost, okay? 1 ounce of soap is proportionate to 1 gallon of water. 1 ounce is proportionate to 1 gallon. So if your sink is about require 10 gallons, then you need 10 ounces of soap. We have already pre-calibrated it so that when you press your detergent pump, the soap that comes in the sink is already measured. So there will be no need for you to be measuring soap every single time you're using the sink. No, it's already done for you to use and work effectively and efficiently. So just so you have this idea, the only time question comes in, what amount of soap do you need for this amount of gallon of water? That is when knowing that is important. Also, you can always read on the soap instructions. It will tell you exactly the amount of soap required for how many gallons of water, okay? All right. So if you do manual cleaning, every medical device, not medical instrumentation, not devices, all medical instruments require some form of manual cleaning. Just that the manual cleaning process varies based on the medical device you're cleaning. For instance, if you are cleaning cables, something like this, cable, these cables are only manually cleaned, right? By using your sponge, soap,